Rat Bite Fever in Thrush by Selena Tharp, Ethan Lipley, Wabeda. Pathogen description. Is the infection viral, bacterial, fungal, protozoan, helminthinic? The infection streptobacillary rat bite fever is classified as a bacterial infection. The infection thrush is classified as a fungal infection. Give the causative agent of each disease. Streptobacillary rat bite fever is an infection disease is caused by two different bacteria, Streptobacillus moniliformis, which causes rat bite fever in North America, Spirillum minus, which causes rat bite fever in Asia. Oral thrush is caused by an abundance of growth of Candida albicans on the lining of the mouth. Describe the morphology of each causative agent. The causative agent of streptobacillary rat bite fever consists of Streptobacillus moniliformis and Spirillum minus. Spirillum minus is in gram-negative cord rod bacteria. The causative agent for thrush consists of Candida albicans being overgrown in the lining of the mouth. Candida is a yeast that are single, oval-shaped budding cells. Describe how each causative agent may be spread. Streptobacillary rat bite fever is spread through bites or scratches from rodents carrying the bacteria. The bacteria itself can enter the body through a bite or through mucous membranes. The bacteria can also be contracted through saliva. Oral thrush is not spread through person, but it can be spread if a person were to come in contact with a person who has this infection saliva, such as kissing a person who has thrush.
Signs and symptoms of rat bite fever include vomiting, headaches, muscle pain, joint pain, or swelling. Rashes are usually around your legs and your feet. If left untreated, rat bite fever can cause severe diseases and death. Symptoms of thrush may include loss of taste, cotton feeling in your mouth, burning or soreness that may be severe enough to cause difficulty eating or swallowing, bleeding if the lesions are rubbed or scratched, cracking, and redness at the corners of your mouth, redness, irritation, and pain under dentures. If left untreated, the symptoms will persist and make your mouth feel uncomfortable. There is a risk of infection spreading. Once scratched, you should first clean out the wound with clean water and soap, or even clean it out with hydrogen peroxide. Then apply skincare ointment on it and cover it up with a band-aid. A healthcare provider will prescribe you with antibiotics that you may have to take up to 2 weeks. In order to prevent this, you should try staying away from rats, avoid areas where they pee and they poop, clean areas that the rats may have peed or pooped in, seal holes around the house so they can't enter, avoid leaving food out since they will easily attract them, wear gloves, goggles, and masks when you clean up after them. Doctors will provide antifungals to treat thrush, which are available in tablets or liquid form, which you may have to take up to 10 to 14 days usually. There are home remedies for it, such as swishing your mouth with warm salt water, taking probiotics, or eating yogurt that contains healthy bacteria. In order to prevent this, you can practice good oral hygiene, meaning brushing your teeth or flossing, avoid certain mouthwash or spray, seeing the dentist on a regular basis, limiting the amount of sugar and yeast containing food we eat, avoiding smoking, and
How common is rat bite fever? In common times, Staphylococcus RBF is a very rare illness to have, in which there's only a 10% chance that the victim can contract it. And this contraction can only be happened due to the exchange of rat bites. So you must have been bitten by an infected rat, which is only prevalent in rat-infested areas. Next question that should arise is, where does rat bite fever most common? The people at highest risk are those who work with laboratory rats or in highly dense areas with rats, which, while having a low chance to infect people due to access and closeness to the rats on a daily basis, it is still a danger. These countries that have the most cases of RBF is Asia, Europe, and North America due to high amounts of rats and how close they are to the public. The dangerousness of wild rats is, while most rats, which are in labs, are a 10% chance, wild rats have a 50 or higher percent chance. An example of a case study of this is when a 61-year-old Japanese man entered the hospital feeling fatigue, experiencing fever and headache. 6 days before administration, he had skin eruptions on the soles, palms, and knees. On his third day in the hospital, he had started to complain about pain in both his knees and shoulders, while there was no issue with his joints when they did X-rays. Due to the skin biopsies, 40 milligrams a day of pinosupine was prescribed. After further examination testing, high thermorphic filamentous gram-negative BRCA was found. After this, imidazopyline sodium bicarbonate sodium was prescribed, and pinosidone was decreased. After the antibiotics had run their course, he had made a full recovery and is able to leave the hospital. Alternatively, how common is thrush? Thrush, in comparison of RBF, is much more common today. Because while it targets everyone across the world, the most affected people are small infants and the immune compromised, in which 37% of all newborns have thrush in the first few months of their lives. Where is thrush most common? Well, thrush seems not to have a large target area or in big significance in most parts of the world, but is highly infectious in infants early in their lives. Due to the baby's smaller, weaker immune system, and since thrush is a fungal infection, they'll wait on the tongue in small amounts so it can spread. The baby is the perfect target for this fungal infection to grow. An example of a case study of thrush is when a 65-year-old woman had been admitted to a hospital because she had been experiencing fever, loss of breath, and cough. She had been prescribed azithromycin of 50 milligrams, cotrimoxazole of 160 milligrams, and 800 milligrams of it monthly, and paracetamol 10 milligrams each month. After over a week, she had white bumps encompassing her mouth, severe oral thrush, and itching. The doctors had discovered a side effect of the prescriptions they had been giving due to the fungal infection, how they were reacting in her mouth, causing it to accelerate the thrush in her mouth. After the prescriptions were diminished, and a few days in the hospital, she was admitted out and made a recovery.
Extra facts. Streptobacillary rat bite fever can progress to involve the heart, lungs, and other organs, leading to death in approximately 10% of untreated patients. Oral thrush can be contracted by anyone, but is mainly only seen in babies. Questions. Has anyone in your family suffered from one of these infections? What were some ways you can get rat bite fever? Babies are most likely to get thrush. True or false?